engine 3. 61 I-6 for operation.
The Independent Living Center of Kern County is a nonprofit agency empowering people with disabilities to live as independently as possible since 1981. The goal of this production is to educate first responders who may be faced with disability-related behaviors in the event of a rescue, disaster, or other circumstances. Independent Living Center of Kern County, ILCKC, recognizes the bottom line for first responders is safety and the safety of others. This video provides input by professionals to consider in the event of interaction with people with disabilities, suggestions for communicating and reacting or involving people and their behaviors in emergency situations for maximum rescue efforts. This video will provide an overview of varying circumstances such as senior citizens, people with sensory disabilities such as those who are blind or visually impaired, who have service animals, and people who are deaf or hard of hearing. Also covered will be people with mobility challenges or who use assistive devices such as wheelchairs, those with cognitive impairments such as autism or mental health disabilities. ILCKC recognizes that the judgment call of first responders precludes all decisions for people with disabilities or able-bodied people in the event of an emergency. A majority of individuals with disabilities live independently. A disability does not mean illness. Even in an emergency situation, these are independent people with rights to choose and make decisions to the same extent able-bodied persons would be consulted. When responding to someone with a disability, if behavioral challenges arise, patience is key. Giving the person time to comprehend what's happening will maximize their absorption of your message, increasing swift transition to the next course of action.
I'd like to welcome you today with this training video to help first responders respond to emergencies in dealing with people with disabilities. The goal of this video is to assist first responders when they're presented with people with disability situations that are different than what we normally are faced with. This video will review situations that people with disabilities are faced with and the reactions that they have in situations of emergencies, including their behaviors. Continued learning is critical for public safety and first responders in dealing with people with disabilities.
Hello, I'm Harvey Flowers with the Independent Living Center. I'm the Special Projects Coordinator there, and I'm also one of the members, board members of the Kern Senior Network. I also attend the Commission on Aging's regular meetings. I'm also a FAST member, which is FAST stands for Functional Assessment Service Team. After a widespread emergency, if people have to be evacuated to a disaster shelter, what I do is I go in and assess their functional needs and find out how we can better assist them to maintain there in the shelter independently. As a teen, I had a stroke, which confined me to a wheelchair, which I need to use the wheelchair to live independently. Me and my wife both have disabilities. We both live independently in our own home. Today here with me I have our senior Jim and our first responder Bree. We're just going to have a little discussion on how to better assist people with disabilities and seniors in the event of a disaster or an emergency call.
Now Harvey, when responding to a senior, sometimes they have certain things like dementia or they're on specific medications and stuff. What would be the best way to increase response times and as well as looking out for safety?
Right, well, just we have to remember, when you get there, if time allows, speak slowly, and always ask the person the best way to assist them. Sometimes they maybe want to be handled differently Some people's range of motion may not allow you to be able to pick them up a certain way. Ask them, what's comfortable for them. Identify yourself. Make sure they know who you are, what you're there for. And like I said, if you may have to ask them a couple of times, how can I help you? And let me introduce you to Jim here. He's our senior. He'd be able to help you out a little bit more, elaborate a little more on this situation as well.
Hi, I'm Jim. I'm a senior. I'm 71 years old. I have breathing difficulties, among other things. One of the issues that I have is a fear of what it might be unknown or what might be going to happen. But also, I'm a person who is still capable. I'm capable of taking part in the decision-making process. So, let me be a part of the decision-making process.
So Jim, what would be the best way that I could help you understand the situation or what's about to happen with what's going on in the emergency?
I am hard of hearing, so it's good to speak to me and keep eye contact with me, speak to me in short, simple sentences, repeat if necessary, if I ask you to repeat, so that I understand, what is going on.
You seem to know what to do and what to say and what you're looking for, pretty much.
Yeah, with my breathing problems, I've called the fire department numerous times to come to my house and to help me out. One of the things that I've asked them to do, if I'm going to be transported to a hospital, I asked them to make sure that I can be in a semi-sitting position in the gurney so my head and chest are elevated so I can breathe well. I would also ask them, since I live alone, to make sure that they can lock the place up. And I would also ask them to ask me if I have other health issues so that they understand, what they're dealing with, so I can go through it with them.
Okay, Jim. Now, some situations require seniors to be evacuated. And in those types of situations, what kind of things can we do to help the situation, go more smoothly?
It's really good if you can tell me, for example, if I'm going to go to a hospital, what hospital I'm going to go to. I have a fear of going to a nursing home. Be specific and say, like, I'm going to such and such hospital. And also, again, to help me I live alone, to be able to lock my place up so everything is secure. But the main thing is, let me know as much as possible where you're going to take me and what's going on.
Ask them, about their mobility impairments or their, if they have hearing loss or vision loss. A lot of seniors have their canes and walkers. They want to take them with them. That's their comfort and their mobility. As for myself, if I'm being evacuated, I want to know that my chair is going to come with me. This is an extension of me. This is how I get around. This is my independence, and this one has been sized up to fit me. It's who I am. So if we can take that with me, that's just going to increase my independence wherever I'm being evacuated to. Also, you want to ask the individuals, if they have any medications that they're currently taking, and if they do, where are they located, so you can grab some of that for them and take it with them.
Okay, well, great. These were all great tips for first responders. Really appreciate it. Jim, Harvey, thank you very much.
Responding to people who are blind or visually impaired. Offer assistance, but allow person to accept or not. If assistance is accepted, allow person to grasp your arm or shoulder. Announce your presence before entering a room or area. Speak naturally. State nature of emergency while offering your arm when leading to safety. Orally communicate any written information. After reaching safety, orient the person to their location, offering further assistance. By law, service animals must be evacuated with the owner.
Hi, I'm Jimmy Soto, the Executive Director for the Independent Living Center of Kern County, and I've been working with people with disabilities for over 10 years, and today I'm with Bree and with Brandy.
Hi, Brandy.
Hi, Bree.
What's something people usually do when communicating with people that are blind or visually impaired?
One of the things that really bothers people who are blind or visually impaired is when people assume that we need their help and they grab our arm and just drag us somewhere. It's usually a little bit easier for the whole situation if you offer help, and then we can usually guide you in the best way to help us.
Okay.
I think one thing that first responders would probably need to know is that there's different levels or categories of somebody being blind and then somebody, say, having low vision or legally blind. And for the most part, most people that have a visual impairment or are considered blind, they do have some vision, even if it's light perception. There's very few people that are just totally blind, no light perception at all. So, you know, somebody even like myself, most people won't know that I do have a visual disability or visual impairment. So for the most part, I can kind of get around, and I don't use a cane, I don't use a guide dog. So it's just one of those things that I think first responders need to know, that there's just different levels. And the other thing is maybe just to offer, do you need help? Do you want to grab my arm? Usually the typical, you know, protocol type thing is to put your arm out, and then they would just grab your arm like this.
Okay.
And then you just walk them out. And of course, if there's a pole there, you gotta move to the left or right. You know, you just don't want to just keep walking. And then of course, you know, describe, hey, I'm coming up to some steps. There's 3 steps. But most people that would have, say, low vision, visually impaired, you know, they're gonna kind of see a little bit of what's going on.
And if you come into a situation, for instance, let's say you go to one of the places where a lot of blind people and visually impaired people congregate, and you have multiple people, then we generally suggest that you create what's called the blind choo-choo. You have one person hang on to you, another blind person or visually impaired person hang on to that person, and then you just kind of in a line. That way you have one arm free to open doors or whatever you need to do, and we're kind of guiding each other.
Okay. Now, in an emergency situation, what would be some good tips, I guess, for us besides the ones that you guys have already discussed?
First thing you want to do is identify yourself, so I know who you are and that you actually know what you're doing. A great example that I can give is during the Twin Towers incident, the team that was working there was a blind gentleman who had a guide dog, and the people that he worked with were in a complete panic. If my dog is calm, tells me that things aren't as bad as everybody thinks they are. Mm-hmm. So I'm not going to just go with anybody. A first responder is the best person for me to deal with. So if you identify yourself as a firefighter, then I'll know that you're the appropriate person. Otherwise, I depend on my dog to guide me generally. And so identify yourself as a first responder and then offer me the help.
Responding to people with service animals. A service animal is not a pet. Evacuate the animal with the owner. Ask permission before petting animal or to give food or water. If dog is wearing its service harness, this means it is on duty. If asked to assist with the service dog, hold the leash.
Now, bringing up service dogs, there's many times that, you know, we come in contact or could come in contact with service dogs. What types of tips or suggestions do you have for us when we do?
The most important thing that you can know about a person who has a service dog is never separate the handler from the service dog. In an emergency situation, they, besides yourself, are going to be our biggest asset. My dog is so well trained that in an emergency situation, I've been in earthquakes, I've been in various situations, and my dog has guided me out safely when others have gotten hurt.
Oh, wow.
Who weren't a person with a disability. So you want to make sure that you always keep a service animal with me. Number one, it's the law. So in an evacuation situation, you know, if the dam breaks in Kern County, that's always one of our biggest concerns. And if I were to need to get into a boat situation, my dog needs to stay with me. The best way I can explain it is for a person who's blind or visually impaired or hearing deficit or something like that, our dog to us is like a person who's in a wheelchair. You can't separate us.
Definitely. Now, do all service dogs, are they required to wear some form of identification or a patch or something that identifies
That's a great
them?
question, actually. No is the best answer I can tell you. Different service animals have different tasks. And as a first responder, you're allowed to ask us 2 questions in a situation where there's an emergency. And number 1, is it a service animal? And number 2, what does it do to help your disability? And for a person who has a guide dog, you're going to be a little more cued in because they're going to be wearing a harness like Eubanks is today.
Okay.
And then a person who has, say, a seizure disorder or something like that won't necessarily have a jacket or anything. We're allowed to basically train our own service animals to our specific needs, but a service animal has to be trained to a specific task.
Okay. That makes sense. Is there any other suggestions or tips when working with or dealing with a service animal?
You'll want to make sure that you always deal with the handler. You kind of want to ignore the dog. The dog, and a service animal, by the way, will always be a dog. In a couple of cases, there's a couple of miniature horses back east, but I don't believe we have any in California right now. So, number 1, it is always going to be a dog. Number 2, you want to deal with the person again, because the dogs are doing their jobs, and if you were to talk to the dog, pet the dog, anything like that, you would distract the dog and could potentially put me in danger.
Okay, so pretty much always asking permission even if we meet you on the street or something, asking permission
Absolutely.
to touch or pet your dog or anything like that.
Of course, it's also going to depend on the nature of the emergency. If you're in a situation where it's kind of a grab and go, then that's going to be completely different. It's always best to use the cues that we've given you today.
Okay.
But, you know, when it's life or death, do what you got to do with us.
Yeah.
I mean, we have a disability, but, you know, I'd rather be alive than anything else.
Absolutely.
Responding to people with mobility impairments. Ask how you can best assist. If evacuation is necessary, respect the person's independence. Ask if there are limitations that may affect their safety. Know that assistance may be needed at times and they can then proceed without assistance. If the person needs to be carried, use the 1 or 2 person carry technique. Evacuating wheelchair users. Speak to the person at eye level. Ask, is the person able to stand or walk without the aid of a wheelchair? If yes, how long? Does the person have full, partial, or no use of their upper extremities?
Hi, I'm Melinda Harrison. I work for MOVE International. MOVE stands for Mobility Opportunity via Education / Experience. We work with people with motor disabilities in sitting, standing, transition with Mitch with the Kern County Fire Department.
The people that you work with, do they have a caregiver with them all the time? Sometimes?
Majority of their day is spent with us. It's amazing how much time when we see them versus maybe the caregiver at home.
Right. So when they leave your care, they're going to be passed on to another caregiver who's going to need to give them that care all the time.
Correct.
Right. As firefighters, we could have a caregiver facility in our area. It's a good idea to become familiar with them and talk to the doctors and nurses and caregivers there to see if we do get called, what is something that we need to do, and that would be good for in case of a fire, in case of any sort of emergency. What are some things some special needs that we might need to bring if we do need to evacuate something or an area? then maybe that means closing a road down and getting other agencies involved, California Highway Patrol or Bakersfield Police Department. You know, oftentimes we do get calls to these areas and to group homes and to places where people have disabilities. And while we're there, we do talk to the nurses and we try to figure out as much information. We get back in the engine, we go back to the station, we talk about it amongst ourselves. If you can contact emergency agencies, the fire department, and even Hall Ambulance, and get them to come out and talk to us about what your needs are, then that kind of helps us pre-plan those situations. Instead of us coming to you, you can come to us and we'll be happy to come out and say, well, we didn't realize this was even here.
Would it be something that we need to talk about on equipment? Because there's a walker, there's a pacer, there's a K-walker, there's a lot of different equipment.
That information coming from you would be huge. If it pertained to like their mobility and there was a mobility issue only, it's probably not going to matter as much because we're going to put them on a gurney. They're going to go to the hospital. They're not going to sit in whatever they're in. Anything that can be folded up and put in an ambulance, easy to transport, it's a no-brainer. We're going to try to send it with them. There's going to be larger items, obviously the larger wheelchairs, the motorized wheelchairs and stuff. But we'll work around it. We'll figure out a way to get there.
I'm going to use an individual. He has a lot of impairments. He's pretty deformed. When you first look at him, we're so used to him when we don't see it, so when you guys come in, first thing that we will do is talk to you about his deformities and what it might look like. So when you're actually coming in and seeing him for the first time, you're not thinking, oh my gosh, that's part of the accident. Actually, that's him himself. A lot of times they'll ask us, how do you pick him up? And we'll say, well, we just literally pick him up. And then when doing that, I'm thinking, oh, that's normal for us, may not be normal for you. Or we'll say, just ask him, he can actually transfer himself. I think sometimes because it's normal for us in our everyday care, we forget, when everything's real excitable and everything's happening, sometimes we have to have a cue to say, what do we need to do?
Sometimes things we've never seen before, just as anybody else, if that's not something that's normal to you, it's going to be take you back for a second. I mean, we don't ever want to show that facial expression to anybody that, well, I've never seen this before. That's the last thing that we want to show, is that we don't know how to handle a situation. And we found out too that a lot of times us coming in can actually make the situation a little bit more tense if somebody doesn't know what's wrong with them. We come in, there's 3 of us, and next thing you know, that if people are a little excited, we bring 3 people in with radios and our bags and stuff, and then 2 more come in with the ambulance, and all of a sudden in a little room, and there's a lot of stuff going on, it can actually make the situation feel a little bit more, tense than maybe it really could be. With people with disabilities, no matter what they are, us not knowing and you knowing the people that you work with a lot, we're able to tell from you, the people in the room, if it's bad or not. Oftentimes that if you've got a really concerned look on your face and I walk in, I talk to you, and you tell me, hey Mitch, this is not the way it's supposed to be, then I've got a pretty good idea that it's a little bit more serious than maybe what we can think. And you can read us, like if we stick to that look on our face, you're like, wow, maybe they need a little bit of help, and that help is always appreciated. As much information as we can get about somebody medically or physically is definitely a huge help for us, and the hospital, the paramedic. That information goes all the way up to give them the best level of care that they can give, that anybody can give them. So.
And I think as a caregiver, when we see you, we just assume you know it all. I mean, you've been through all the training, you know all the first aid. In the past, when they ask just a few questions, it'll dawn on us to say, oh yeah, I got to remind them, he does this or she does that.
That's all communication.
It really is.
Right.
When our individuals aren't able to vocalize as far as communicating how I feel or why this hurts, they'll give a different response. Maybe it might be a scream, or it might be that's just how they are really happy, and they're showing a different way. We have a gentleman that he just screams all the time, not in pain. He's just one of his ways of saying, here I am. And when we run into a situation, people come in, they're like, oh my gosh, what's wrong with him? We're like, oh, no, he's just talking to us. Sometimes that can kind of set people back, not really thinking about how he really might be responding when he really is in pain.
Right. You would definitely see a reaction from myself, and I'm sure a good portion of our crews, if we were on a medical aid and the person started screaming, that's not a normal situation for us, but that information that you give us, that communication, almost instantaneously, no, you see a look on our face, no, that's normal. That changes how we're expecting it the next time. And I think that would be huge. That's a great piece of information for us to have. Hey, if he does do this while you pick him up, be prepared for him to yell. We associate yelling or screaming with pain, and like I said, we don't want to make that situation any worse. We want to make it better. We also do realize that sometimes people that have fallen or hurt, there's going to be a level of pain from where they're at to where we can get them stabilized, and that movement is something that we can't leave them there on the floor. We got to get them to the hospital, and I oftentimes will talk to people, hey, this is going to hurt for a minute, but it's a necessity. And I think most people, from what I understand, they understand that, they get that it could be short-lived, but that's us communicating with them. And if we can't communicate with them, maybe you can, and that's where we'd bring somebody over who's very close with them to get that information to them. Hey, calm down, this is what's going on, because they're going to feel more comfortable with you than they are with us.
I've always found that you guys are really genuine as far as talking to the individual. You'll ask them questions, whether they can answer it or not. If they can help in the situation, you'll ask them, can you stand, or can you assist us? Again, it's that communication, going back and explaining to them, I've got to pick you up. This is how I'm going to pick you up. This is why I got to do it.
Right.
Communication is definitely the key here. As long as you tell them what's going to take place.
It's important that we know that we take special thought about the people with disabilities and keep that in the back of our mind, but also to know that we should be treating everybody, and I'm sure we are, as our mothers or wives or daughters or sisters or sons.
Responding to people with cognitive disabilities, autism, mental health, epilepsy. Be patient. Speak calmly using direct phrases. Give one command at a time. Break down information into simple steps, allowing extra time for person to comprehend and respond. Use simple signals or symbols. Read written information.
Hello, my name is Gil Madrid, and I'm with Kern County Mental Health, and I'm the disaster coordinator as well as in charge of safety and security for the mental health department. And today I would like to introduce Mitch with Kern County Fire Department.
Gil, what are some issues that you see that would be presented to firefighters when dealing with people with mental illness?
Well, I understand that when there is a disaster, the people have problems, and someone with mental health problems, that could make it even worse. So what your firefighters have to be is very sensitive to the people that they're dealing with, and try to find somewhere that is quiet and not disrupting everything. And I think that if you can be more personable, that would enhance your ability to get information from the individual.
Sure. So when dealing in natural disasters, people with medical emergencies, oftentimes putting them in a quieter place without so much commotion around can sometimes make it a little bit easier for us to get information from them when trying to get medical history or even the chief complaint of the problem that they might be having.
That is correct. And if your staff is able to become personable, that way it will really enhance their ability to get the information that you need.
We like to have a good rapport with our customers and our patients. People who need us have a tendency to call and have a problem. I think it's, as firefighters, we're trained to solve a problem. We may not necessarily know that a patient we're going to be show up on has a mental illness. Are there some signs that might present themselves to us to help us be a little bit more aware of the surrounding with the patient's medical conditions?
Well, you know, they may be disruptive, may be nervous, they could scream and shout, do things that were out of the ordinary. And if you ask them if they have any type of mental illness, they may tell you, or they may not. But again, it has to be done in such a manner that you're trying to achieve some kind of relationship with them.
So building a relationship with somebody with mental illness is very important to them, that connection,
Right.
where they feel that they can trust you, where we may not, we take that for granted with a lot of the people that we work with, where we might have to build that rapport possibly a little bit more to get more information, to feel trusted, is that what you're saying?
Yes, exactly. And the greater the rapport, the greater the information that you're going to get from the individual.
Does your department have any means that we could refer people to with mental illnesses as a way of seeking more help for them? Is there a procedure in place that we could a reference?
We have a site at Mary Kay Shell, and if it's a 5150 scenario, which means if a person is a danger to themselves or to others, then they can be taken to the PEC unit at Mary Kay Shell. Mary Kay Shell also has people that can go in and request counseling. So it depends on the individual and the scenario. But we do have teams that are available to assist anyone that needs mental health counseling.
Are those teams available to us in the field, or is that something that needs to be done at Mary Kay Shell?
Well, again, we do have the MET team that works with the fire department and police department, and they can be called out to assist on site if necessary.
And that's all areas of Kern County? Is there
Yes.
multiple MET teams or just one?
Well, we have MET teams that carry in various areas of the county.
Responding to people with autism. Speak slowly. Use simple commands. Use concrete terms. Allow time for response. Avoid using phrases that have double meanings. If time allows, look for identifying bracelet or identification card signifying person has autism spectrum disorder. Give lots of praise. Do not attempt to physically block self-stimulating behavior. Check for injuries. Pain isn't shown. No, there is a lack of social understanding. Sensory and behavior tips. No, person may not understand what you say. Appear deaf. Person may be unable to speak or speak with difficulty. Person may engage in repetitive behaviors. Person may act upset for no apparent reason. Person may appear insensitive to pain. Person may appear anxious or nervous. Person may dart away from you unexpectedly. Person may engage in self-stimulating behaviors. Person may not understand the law, know right from wrong, or consequences or actions.
Hi, my name is Ramona Puget, and I am the president of the Autism Society affiliate, Kern Autism Network for Bakersfield. And with me today, joining me is Scott Rice, who is a 40-year-old adult, high-functioning, with autism. And we have a first responder from the Kern County Fire Department, Bree.
Is there any way that first responders are able to tell if someone has autism?
Mostly, some of them will have some type of identification card on them, especially if they have a little carry type card that states I have autism. If an emergency occurs, like at a school district, they're going to be with a special ed program. We've had several workshops here in Kern County where we've given parents identification cards that they can carry in their cars, in their wallets, put in their children's backpacks. If they don't have them there, we've told them to place them on the refrigerators of their homes. So if something happens in the home, it's the first place that first responders will go to is the refrigerator. So,
okay.
Sometimes we can carry medical alert bracelets.
Okay. So what type of response from somebody with autism can first responders expect? Or do they all act the same way?
No, there's different levels. You have those that are very low functioning and those that are very high functioning. Those that are low functioning may not vocalize anything to you. They may act like they they don't understand you, or they may try to run from you. They may even try to do something like, behaviors as far as kicking you or whatever. And sometimes first responders think that, they're trying to get away, especially if they're telling them to stop. You don't want the first responder to just knock them down, because to them, it's a flight or fleet kind of thing, and they will react however they're feeling at that moment.
Okay.
Again, it's not out of disrespect or anything. It's just, it's really difficult for them to process everything and be able to figure out exactly what's being asked of them. And they may think it's a game too. So if you start chasing them, the only way to get them to stop is taking them down. You got to be careful, because a lot of times first responders don't quite understand that they don't respond like others do, where they're going to stop, put their hands up, and and all of that. They're not going to do that. They're not going to understand. So
what would you suggest be, if we do have a patient that is fleeing like that, running away or combative, what would you, and it's not in a true emergency situation where evacuation is, an immediate need.
absolutely.
What could we do?
Depending on where the situation is, obviously they're not going to be alone, okay?
Yeah.
So if they are alone, you're going to have firsthand information of people telling you that you're dealing with an autistic individual. You're going to get the before you go, and then you're going to know what to expect. Okay. But if you're in a situation like you're at a school district or something and that happens, definitely use the folks that are working with them to come in and help assist, because they know the child. And so if there's a teacher, there's an aide, they may have a one-on-one aide that's assigned to them. Let them control the behavior and get them where they need to, so that you can better assist. And they're going to be the ones that you're going to want to approach.
Now, I've been, in situations or on calls, as I'm sure other firefighters have as well, where we're trying to gather some information from a patient, and they end up just keep on repeating, the same question that we're asking them back to us. Why is that, and is there anything that we can change?
Yeah, there's actually a word for it. It's called echolalia, and it's their way of being able to hear what you're telling them, repeat it back in their head. It's kind of like a movie dialogue. It's just something that they're repeating. They're not doing it out of disrespect, but they're basically doing it to just better understand what you're stating to them, so that they can kind of get it in their mind as to what is it that you're asking me, so that they can answer back if they're able to, if they're verbal.
Do most individuals with autism, do they usually react and act in a similar way?
No, there's different degrees of autism. It does affect their sensory, it does affect their communication, so you may have some that are higher verbally, and then those that are completely nonverbal. It also affects their behaviors, and so behavior-wise, you can get some really odd behaviors, or you can actually get behaviors where it looks like it's a panic attack, there's anxiety. Again, there's a lot of sensory issues going on because they don't understand their surroundings. And so if they're being asked questions by a first responder, they may be a little scared of your uniform, the sirens, whatever it may be. So it affects all of that. And so again, for the levels of what you're going to see, it's going to really be determined on if they're verbal, nonverbal, if they're high functioning, like Scott is very high functioning.
Okay. Is it appropriate to ask, what level of or is it pretty much you can pretty much tell?
You can pretty tell, yeah. You can pretty much tell. If you're at a school district and say, for instance, a fire occurs or something, they're going to be with a special ed teacher, so they're going to be able to tell you these kids are nonverbal, or they're a little higher functioning, but they still don't quite understand what you're saying. Especially WH questions are really difficult for them. The what, where, why, when, who, that type of thing. So Scott could probably explain a little more of that.
Yeah, sometimes when you ask what is going on, sometimes they don't understand it or get stressed about it, so they have to get a processing in their mind to understand it.
Okay. Now, in let's say like in an emergency situation, and time is of the essence. We need to get out of there quick. What would be the best way to get some a person with autism out quickly?
Well, again, it depends on the situation. I mean, you've got to do what you have to do for your training, and they don't like to be touched. And so if you have to pick them up, you're going to have to pick them up, but they're like dead weight. So you're just going to have to explain, I'm not here to hurt you. I need to get you out of here to be someplace safe. And again, they may not grasp that right away, but if you have to follow through, safety's first. Definitely. So if you're going to get kicked and whatever, I mean, it's going to happen, but it's not being done because they're scared. Their anxiety level goes extremely high. They start to panic. They have panic attacks, things like that. You don't know if they're on medication. So again, if you have to react fast, then, just let them know that you're going to be touching them so that you can move them to a safer place. So.
Okay. But if, if we do have time, then, take that time to explain what you're doing and what the plan is and where you're going.
Absolutely.
And everything like that.
You kind of have to, they do better with visual clues. So if you have to show them something in particular, we're going to go here, we're going to do this, or if they have an injury, they have extremely high tolerance for pain. So they may have a gash and not even feel it.
Not even know.
No.
Okay.
Yeah, there's sensory issues, so they don't know how where the pain is.
Okay. So if a situation presents itself with, let's say, a car accident and both parents are, taken to the hospital in the ambulance and the child is fine, what's the best way to communicate with him or her, and what can we do with the child? Would it have been best to send the child with one of the parents in the ambulance, depending on injuries, or what would be the best thing to do?
Depending on the injuries, if the parent is coherent, you definitely want to be able to keep the child near them if possible. Again, if there's any ID cards or emergency contact numbers, I would try to contact someone else that is familiar with the family if there's anything on them. That you could call and say, there's been a car accident, we need someone to come in and help us with this child. If the child is nonverbal, but they've always got stuff with them. So if there's a video game in the car with them, there's Cheerios, whatever it may be, take that with you, because that's going to help you to kind of lure them and get them to be a little more comfortable with you, knowing you're not taking their comfort items away from them, but we're going to take this and we're going to put this over here. If they're very interested in, say, the hat or whatever, the uniform or whatever, and they're really excited about this, and they're oblivious to what's happened to the family, then go with that. If they're willing to just kind of, they're very curious about the uniform, or, let them try it on, let them wear the hat. That's how you're going to gain their ability to be more accepting towards whoever's trying to help them. Instead of someone trying to be forceful with them. But if you can call in another support person, then I would definitely do that. But if that's not the case, which sometimes that could happen, try to really keep that with, noticing what is in the car, what can we take with us, blankie, whatever it may be, just to keep that child occupied until you can get them to a safer place.
Okay. And if the child is nonverbal, what would be the best way for a first responder to communicate with them?
Some of the kids do sign language. A lot of kids have iPads as well, so there might be a communication device in the car.
Okay.
And if there is, that's great, but a lot of times that's not the case. Like my son has an iPad that it has a whole complete
Pictures
app. It's got pictures, and you just point on them and boom, comes up, and it actually talks for you and everything.
Okay.
Again, not all individuals have that, but if it's there, use it. If it's not, then again, you could just show them as much as you can, and talking to them very slowly. I mean, again, in an emergency situation, you need to do what you need to do. And if that car is about ready to blow up, get them out of there. I mean, just keep them safe, but always check them too for injuries. Because like I said, they may present that they don't have anything, but if they weren't in a seatbelt appropriately, or they were rolling around in the car, whatever, I would have them checked anyway, because again, you never know with them, because they're not going to complain.
Yeah.
Right?
Yeah.
Not going to complain. So.
Just high sensory.
Okay. Do either of you have anything helpful to add that could help firefighters?
Basically, it's just trying to understand that they process things very differently. And so what may look like to you, you know, it's an emergency situation and they're not cooperating. It's not that they're not cooperating, they're just really scared. There's a huge anxiety factor there. So again, you know, don't judge a book by its cover, because you never know what you're going to get. You may get one that's extremely compliant, or you may get one that will just go into full blown behavior, and it's not out of disrespect or anything. It's just they just don't understand their environment. And again, it's that social understanding. They don't catch the cues. So
Okay, great. Thank you so much. It'll definitely help us in the future.
Yeah.
Tips when responding to people who are deaf or hard of hearing. Know the difference between hearing impaired and deafness. If possible, when entering an area, flick the lights on and off to get attention. Establish eye contact with the individual, not with the interpreter if one is present. Use normal facial expressions and hand gestures as visual cues. Check to see if you are understood. Repeat and rephrase if necessary. Written communication may be necessary. Keep instructions simple and in present tense. Use basic vocabulary. Some people may be fluent in American Sign Language, ASL, and may be more dependent on ASL than English. Do not over-enunciate. Do not block your mouth with hands or objects when speaking. Do not allow others to interrupt you while conveying emergency information. Patience helps when the person is having difficulty understanding the urgency of your message. Provide a flashlight in order for the person to signal their location in the event they're separated from the rescue team. Know that people who are either deaf or hearing impaired do not consider themselves disabled.
Hello, I'm Janice England. I'm the Outreach Coordinator for the Bakersfield, Greater Los Angeles Agency on Deafness. And I'm here with an interpreter whose name is Tom Moran. And I'm joined by firefighter Mitch. I'd like to talk to you a little bit about what the difference is between being deaf and hard of hearing. Hearing loss can range from mild to profound, and some people are unable to hear anything at all. Hard of hearing people have a somewhat of a hearing loss. They may or may not wear hearing aids or other devices that will enable them to hear. Lip reading is a widely misunderstood myth. Only 30% of the words can be visible on the mouth. It involves a lot of assumption and a lot of guessing and is not a reliable mode of communication. You might see a variety of situations where you'll meet someone and you're not aware of whether or not they're deaf or hard of hearing. So before you meet that person, in order to get their attention, you can either wave or tap them on the shoulder. People who are deaf strongly prefer to use interpreters, although sometimes it's possible to do minor communication with lip reading or by writing back and forth. It's essential that you make eye contact with a deaf or hard of hearing person, especially if you're not working with an interpreter.
Oftentimes we wear personal protective gear that covers our face. Is this going to cause issues with people with hearing difficulties?
Yes, it will. You want to make sure that with your emergency equipment, if it's possible, it doesn't cover your face. If it does, emote with facial expressions and use gestures. You can communicate very effectively through body language, just indicating to somebody where they should go or what they should do. Of course, that tip is going to be helpful to anyone, whether they're able to hear or not. You can ask the person, do they understand? Or may ask them what's going on, or if something needs to be repeated. Just make sure that you understand. And also there's the possibility of writing back and forth as well. Maybe it would be helpful if they're not able to understand you. The person might prefer sign, but if you speak very, very clearly, don't over-enunciate, but just speak freely and clearly, and you can sometimes communicate simple things that way.
So what are some things that we could do for you to assist you in case of emergency?
Well, tap the person on the shoulder and indicate to them where they need to go, and that's what's really important. If you're not able to communicate verbally, then just stay close to the person and guide them out. That would be my best advice. That's whether a person is deaf or hard of hearing, just tap them on the shoulder like this, indicate, come with me, and stay with them until you get them out of harm's way. For firefighters, a situation that might come up, if they're talking and they see the person doesn't respond, and it would be good for them to assume that they've got a severe hearing loss, that they're not going to be able to communicate verbally. What's most important at that point is body language. Wave to get their attention, motion to say, come this way, and if you find it necessary to grab the person physically, to do so gently and calmly.
The disability with deafness is one that is just a simple communication issue, and whether you are deaf or you speak Spanish, I still have those same communication barriers that we have to get through.
So I'm curious, firefighters, you talked about understanding each other in situations. Do you guys use body language at times to communicate? What sort of things, or facial expressions? Do you speak loudly? How do you try to overcome those communication issues that you experience?
Right. Speaking loudly is probably the best thing for us in the situation that we're in. When you have the mask covering your face, a lot of times your enunciation can be very difficult, and we can't remove it. We also have voice boxes on the side of our mask that help get what we're saying without yelling. Personal contact, grabbing somebody's coat, grabbing them, come this way with me, tapping them on the shoulder to get their attention. It's very much like dealing with someone with hearing disabilities, because they're working, spraying water, sirens loud, and a lot of things are happening. We don't necessarily hear a lot too. So physical contact is something that we use quite a little bit too. And we like to stay physically connected to each other by hand contact. Sometimes we'll tie ropes to each other. So that's the way that we keep from getting separated too.
So firefighters don't become panicked then necessarily. So if a disabled person or somebody with a hearing loss were to latch onto you, that would be customary, normal.
Very much. Anytime in a panic situation, somebody's going to latch onto you. Whether you're in the lake and somebody's drowning, the first thing that they're going to do is grab onto you. And in a panic situation, if you're not incapacitated and you're conscious and breathing and you need help, the first thing you're going to want to do is you'll oftentimes they'll grab onto the rescuer.
Let me jump in here. You were speaking about somebody that had a service dog, and we often think about that with people that have visual problems, but a lot of other people have service dogs with them too. Some deaf and hard of hearing people do have dogs that will alert them to sounds that are being made and what kind of sounds those are.
Right, and that's a good information, because we don't often deal with service dogs, and we would definitely not want to remove a service dog from somebody that has a disability, especially if it's helping them communicate with us, whether we know it or not. I guess for us, it would be important that if someone does have a service dog and they're unable to communicate, to put some sort of identification on the service dog so we can put two and two together, because that's the last thing we would actually want to do is remove something from somebody that's helping them.
Good point. Really, the best thing for you to do is, I can't emphasize enough, to stay close. That should be a department protocol.
Right, and oftentimes we will. If I've made contact with somebody that's in distress, we're going to stay with them until we've gotten them out of that situation. We don't have a policy or in place to leave people behind. My goal would be the person that I'm with at that time. And if I can't handle the situation, I'll make sure I can get people in to handle the situation at that time. Life safety, people are our most important priority. That's it. We can rebuild buildings, but I can't rebuild a person. These have all been great points that we've been able to talk about today. I'd like to thank you, Janice, for being here, and Tom, thank you for your help today.
Independent Living Center of Kern County hopes these tips assist first responders in their effort in working with people with disabilities. It is our hope you'll be more comfortable when responding to people with disabilities and their behaviors in an emergency situation. Our hope is that you maneuver through these encounters as quickly as possible. Please stay safe. Independent Living Center of Kern County applauds the efforts and work of first responders as you contribute tirelessly to the safety of the communities you serve.